Lancaster County and that breaking news coming in the last hour. The first case of coronavirus in the Charlotte area.
A woman has tested positive, and we want to go right now to our South Carolina reporter, Greg Suskin. He's got the latest on what we know about this case. Greg?
Yeah, and DX's been putting out information about new coronavirus cases in South Carolina just about every day since last week. And here's what we can tell you about this case. This is a woman from Lancaster who apparently tested positive for coronavirus at a DHEC health lab. And I checked, and there really are no DHEC health labs in Lancaster or anywhere around Lancaster. So it's not clear at this point which hospital she's being kept at, where she's being treated. But we do know at this point, DHEC says there is no evidence that she traveled out of the state, and also no evidence that she came in contact with any of the other victims in the state. And that brings the total in South Carolina to 10 cases. Now, 8 of those are presumptive cases, which basically means a positive test came back, but it's not been confirmed by the CDC. 2 of those cases have been confirmed. It's also important to point out that of those 10 cases, 7 are down in Camden in the Kershaw area. There's also a woman from Charleston, a man from Spartanburg, both of whom did travel out of the country to Italy, and now this case of this woman in Lancaster as well. Back to you.
Oh, Greg, so we talked about this earlier, and Governor Cooper talked about in his health officials what's called community spread. That's where the virus gets to the point where they can't trace where people are getting it from. It's just really kind of exponentially spreading through the community. And I know we said that this case in Lancaster County, at this point, of course, it's very early, they kind of can't trace it back. So we know health officials will try to do that. But what are you hearing about what will happen there in Lancaster County as they try to track that down?
Right. We do understand this person is doing well and being treated, so I'm sure they're asking her all kinds of questions. Of course, that's really question number one is where have you been? Who have you seen? Who have you come in contact with? And when they put out this initial information, it's from the initial interview with this person to try to determine, some of the obvious questions. Did they travel out of the country? Were they maybe down in the Camden area where they might have come in contact with some of these other cases? At this point, they're saying no, but there's, of course, still a lot of investigation to be done. And when it comes to community spread, again, really a big question mark. They have to kind of see if they can trace that back and figure out if there's any connection that they might have to another case.
All right, that is the big fear, of course. Thank you, Greg, that's when it can really start to spread very quickly.